V62.3 Academic problem, V62.4 Acculturation problem, 308.3 Acute stress disorder, adjustment disorders, 309.9 Unspecified adjustment reaction NOS, 309.24 with anxiety, 309.0 with depressed mood, 309.3 with disturbance of conduct, 309.28 with mixed anxiety and depressed mood, 309.4 with mixed disturbance of emotions and conduct. V71.01 Adult antisocial behavior, 995.2 Adverse effects of medication NOS, 780.93 Age-related cognitive decline, 300.22 Agoraphobia without history of panic disorder, alcohol, 305.00 Abuse, 303.90 Dependence, 291.89 Induced anxiety disorder, 291.89 Induced mood disorder, 291.1 Induced persisting amnestic disorder, 291.2 Induced persisting dementia, 291.5 Induced psychotic disorder, with delusions, 291.3 Induced psychotic disorder, with hallucinations, 291.89 Induced sexual dysfunction, 291.89 Induced sleep disorder, 303.00 Intoxication, 291.0 Intoxication delirium, 291.9 Related disorder NOS, 291.81 Withdrawal, 291.0 Withdrawal delirium. Amnestic disorder, 294.0 Amnestic disorder due to indicate the general medical condition, 294.8 Amnestic disorder NOS. Amphetamine, 305.70 Abuse, 304.40 Dependence, 292.89 Induced anxiety disorder, 292.84 Induced mood disorder, 292.11 Induced psychotic disorder, with delusions, 292.12 Induced psychotic disorder, with hallucinations, 292.89 Induced sexual dysfunction, 292.89 Induced sleep disorder, 292.89 Intoxication, 292.81 Intoxication delirium. 292.9 Related disorder NOS, 292.0 Withdrawal. 307.1 Anorexia nervosa, 301.7 Antisocial personality disorder, anxiety disorder, 293.84 Anxiety disorder due to indicate the general medical condition, 300.00 Anxiety disorder NOS. 299.80 Asperger's disorder, attention deficit hyperactivity disorder, 314.01 Combined type, 314.01 Predominantly hyperactive impulsive type, 314.00 Predominantly inattentive type, 314.9 Attention deficit hyperactivity disorder NOS. 299.00 Autistic disorder, 301.82 Avoidant personality disorder, TOP. B. V62.82 Bereavement, bipolar disorder, 296.80 Bipolar disorder NOS, bipolar I disorder, most recent episode depressed, 296.56 in full remission, 296.55 in partial remission, 296.51 mild, 296.52 moderate, 296.53 severe without psychotic features, 296.54 severe with psychotic features, 296.50 unspecified. 296.40 Bipolar I disorder, most recent episode hypomanic, bipolar disorder I, most recent episode manic, 296.46 in full remission, 296.45 in partial remission, 296.41 mild, 296.42 moderate, 296.43 severe without psychotic features, 296.44 severe with psychotic features, 296.40 unspecified. Bipolar disorder I, most recent episode mixed, 296.66 in full remission, 296.65 in partial remission, 296.61 mild, 296.62 moderate, 296.63 severe without psychotic features, 296.64 severe with psychotic features, 296.60 unspecified. 296.7 bipolar I disorder, most recent episode unspecified, bipolar I disorder, single manic episode, 296.06 in full remission, 296.05 in partial remission, 296.01 mild, 296.02 moderate, 296.03 severe without psychotic features, 296.04 severe with psychotic features, 296.00 unspecified. 296.89 bipolar II disorder. 300.7 body dysmorphic disorder, V62.89 borderline intellectual functioning, 301.83 borderline personality disorder, 780.59 breathing-related sleep disorder, 298.8 brief psychotic disorder, 307.51 bulimia nervosa, top. C. Caffeine, 292.89 induced anxiety disorder, 292.89 induced sleep disorder, 305.90 intoxication, 292.9 related disorder NOS. Cannabis, 305.20 abuse, 304.30 dependence, 292.89 induced anxiety disorder, 292.11 induced psychotic disorder, with delusions, 292.12 induced psychotic disorder, with hallucinations, 292.89 intoxication, 292.81 intoxication delirium, 292.9 related disorder NOS. 293.89 catatonic disorder due to indicate the general medical condition, 299.10 childhood disintegrative disorder, V71.02 child or adolescent antisocial behavior, 307.22 chronic motor or vocal tic disorder, 307.45 circadian rhythm sleep disorder, cocaine, 305.60 abuse, 304.20 dependence, 292.89 induced anxiety disorder, 292.84 induced mood disorder, 292.11 induced psychotic disorder, with delusions. 292.12 induced psychotic disorder, with hallucinations, 292.89 induced sexual dysfunction, 292.89 induced sleep disorder, 292.89 intoxication, 292.81 intoxication delirium, 292.9 related disorder NOS, 292.0 withdrawal. 294.9 cognitive disorder NOS, 307.9 communication disorder NOS, conduct disorder, 312.81 childhood onset type, 312.82 adolescent onset type, 312.89 unspecified type. 300.11 conversion disorder, 301.13 cyclothymic disorder, top. D. Delirium, 293.0 delirium due to indicate the general medical condition, 780.09 delirium NOS. 297.1 delusional disorder, dementia due to Creutzfeldt-Jakob disease, 294.10 without behavioral disturbance, 294.11 with behavioral disturbance. Dementia due to head trauma, 294.10 without behavioral disturbance, 294.11 with behavioral disturbance. Dementia due to HIV disease, 294.10 without behavioral disturbance, 294.11 with behavioral disturbance. Dementia due to Huntington's disease, 294.10 without behavioral disturbance, 294.11 with behavioral disturbance. Dementia due to Parkinson's disease, 294.10 without behavioral disturbance, 294.11 with behavioral disturbance. Dementia due to Pick's disease, 294.10 without behavioral disturbance, 294.11 with behavioral disturbance. Dementia due to indicate other general medical condition, 294.10 without behavioral disturbance, 294.11 with behavioral disturbance. 294.8 Dementia NOS, dementia of the Alzheimer's type, with early onset, 294.10 without behavioral disturbance, 294.11 with behavioral disturbance. Dementia of the Alzheimer's type, with late onset, 294.10 without behavioral disturbance, 294.11 with behavioral disturbance. 301.6 Dependent personality disorder, 300.6 Depersonalization disorder, 311 Depressive disorder NOS, 315.4 Developmental coordination disorder, 799.9 Diagnosis deferred on axis 2, 799.9 Diagnosis or condition deferred on axis I, 313.9 Disorder of infancy, childhood, or adolescence NOS, 315.2 Disorder of written expression, 312.9 Disruptive behavior disorder NOS, 300.12 Dissociative amnesia, 300.15 Dissociative disorder NOS, 300.13 Dissociative fugue, 300.14 Dissociative identity disorder, 302.76 Dyspareunia, 307.47 Dysomnia NOS, 300.4 Dysthymic disorder, TOP. E. 307.50 Eating disorder NOS, encoprasis, 787.6 encoprasis, with constipation and overflow incontinence, 307.7 encoprasis, without constipation and overflow incontinence. 307.6 Aneurosis, 302.4 Exhibitionism, 315.31 Expressive language disorder, TOP. F. Factitious disorder, 300.19 with combined psychological and physical signs and symptoms, 300.19 with predominantly physical signs and symptoms, 300.16 with predominantly psychological signs and symptoms, 300.19 Factitious disorder NOS. 307.59 Feeding disorder of infancy or early childhood, 625.0 Female dyspareunia due to indicate the general medical condition, 625.8 Female hypoactive sexual desire disorder due to indicate the general medical condition, 302.73 Female orgasmic disorder, 302.72 Female sexual arousal disorder, 302.81 Fetishism, 302.89 Flotterism, TOP. G. Gender identity disorder, 302.85 in adolescents or adults, 302.6 in children, 302.6 Gender identity disorder NOS. 300.02 Generalized anxiety disorder, TOP. H. Hallucinogen, 305.30 Abuse, 304.50 Dependence, 292.89 Induced anxiety disorder, 292.84 Induced mood disorder, 292.11 Induced psychotic disorder, with delusions, 292.12 Induced psychotic disorder, with hallucinations, 292.89 Intoxication, 292.81 Intoxication delirium, 292.89 Persisting perception disorder, 292.9 Related disorder NOS. 301.50 Histrionic personality disorder, 307.44 Hypersomnia related to indicate the axis I or axis II disorder, 302.71 Hypoactive sexual desire disorder, 300.7 Hypochondriasis, TOP. I. 313.82 Identity problem, 312.30 Impulse control disorder NOS, inhalant, 305.90 Abuse, 304.60 Dependence, 292.89 Induced anxiety disorder, 292.84 Induced mood disorder, 292.82 Induced persisting dementia, 292.11 induced psychotic disorder, with delusions, 292.12 induced psychotic disorder, with hallucinations, 292.89 intoxication, 292.81 intoxication delirium, 292.9 related disorder NOS, 307.42 insomnia related to. Indicate the axis I or axis 2 disorder, 312.34 intermittent explosive disorder, top. K, 312.32 kleptomania, top. L, 315.9 learning disorder NOS, top. M, major depressive disorder, recurrent, 296.36 in full remission, 296.35 in partial remission, 296.31 mild, 296.32 moderate, 296.33 severe without psychotic features, 296.34 severe with psychotic features, 296.30 unspecified. Major depressive disorder, single episode, 296.26 in full remission, 296.25 in partial remission, 296.21 mild, 296.22 moderate, 296.23 severe without psychotic features, 296.24 severe with psychotic features, 296.20 unspecified. 608.89 male dyspareunia due to. Indicate the general medical condition, 302.72 male erectile disorder, 607.84 male erectile disorder due to. Indicate the general medical condition, 608.89 male hypoactive sexual desire disorder due to. Indicate the general medical condition, 302.74 male orgasmic disorder, V65.2 malingering, 315.1 mathematics disorder, medication-induced, 333.90 movement disorder NOS, 333.1 postural tremor, 293.9 mental disorder NOS due to. Indicate the general medical condition, mental retardation, 319 mental retardation, severity unspecified, 317 mild mental retardation, 318.0 moderate mental retardation, 315.31 mixed receptive expressive language disorder, mood disorder, 293.83 mood disorder due to. Indicate the general medical condition, 296.90 mood disorder NOS. Top. N, 301.81 narcissistic personality disorder, 347 narcolepsy, neglect of child, V61.21 neglect of child, 995.5 neglect of child. Neuroleptic induced, 333.99 acute akathisia, 333.7 acute dystonia, 332.1 Parkinsonism, 333.82 tardive dyskinesia, 333.92 neuroleptic malignant syndrome. Nicotine, 305.1 dependence, 292.9 related disorder NOS, 292.0 withdrawal. 307.47 nightmare disorder, V71.09 no diagnosis on axis 2, V71.09 no diagnosis or condition on axis I, V15.81 non-compliance with treatment, top. O, 300.3 obsessive-compulsive disorder, 301.4 obsessive-compulsive personality disorder, V62.2 occupational problem, opioid, 305.50 abuse, 304.00 dependence, 292.84 induced mood disorder, 292.11 induced psychotic disorder, with delusions, 292.12 induced psychotic disorder, with hallucinations, 292.85 induced sleep disorder, 292.89 induced sexual dysfunction, 292.89. Intoxication, 292.81 intoxication delirium, 292.9 related disorder NOS, 292.0 withdrawal. 313.81 Oppositional defiant disorder, 625.8 Other female sexual dysfunction due to. Indicate the general medical condition, 608.89 Other male sexual dysfunction due to. Indicate the general medical condition, other substance, 305.90 Abuse, 304.90 Dependence, 292.89 Induced anxiety disorder, 292.81 Induced delirium, 292.84 Induced mood disorder, 292.83 Induced persisting amnestic disorder, 292.82 Induced persisting dementia, 292.11 Induced psychotic disorder, with delusions, 292.12 Induced psychotic disorder, with hallucinations. 292.89 Induced sexual dysfunction, 292.89 Induced sleep disorder, 292.89 Intoxication, 292.9 Related disorder NOS, 292.0 Withdrawal. Top. P. Pain disorder, 307.89 Associated with both psychological factors and a general medical condition, 307.80 Associated with psychological factors. Panic disorder, 300.21 with agoraphobia, 300.01 without agoraphobia. 301.0 Paranoid personality disorder, 302.9 Paraphilia NOS, 307.47 Parasomnia NOS, V61.20 Parent-child relational problem, V61.1 Partner relational problem, 312.31 Pathological gambling, 302.2 Pedophilia, 310.1 Personality change due to. Indicate the general medical condition, 301.9 Personality disorder not otherwise specified, 299.80 Pervasive developmental disorder NOS, V62.89 Phase of life problem, phencyclidine, 305.90 Abuse, 304.90 Dependence, 292.89 Induced anxiety disorder, 292.84 Induced mood disorder, 292.11 Induced psychotic disorder, with delusions, 292.12 Induced psychotic disorder, with hallucinations. 292.89 Intoxication, 292.81 Intoxication delirium, 292.9 Related disorder NOS. 315.39 Phonological disorder, physical abuse, V61.12 Physical abuse of adult, V62.83 Physical abuse of adult, 995.81 Physical abuse of adult, V61.21 Physical abuse of child, 995.54 Physical abuse of child. 307.52 Pica, 304.80 Polysubstance dependence, 309.81 Post-traumatic stress disorder, 302.75 Premature ejaculation, 307.44 Primary hypersomnia, 307.42 Primary insomnia, 318.2 Profound mental retardation, 316 Psychological factors affecting medical condition, psychotic disorder due to. Indicate the general medical condition, 293.81 with delusions, 293.82 with hallucinations, 298.9 Psychotic disorder NOS. 312.33 Pyromania, top. R. 313.89 Reactive attachment disorder of infancy or early childhood, 315.00 Reading disorder, relational problem, V62.81 Relational problem NOS, V61.9 Relational problem related to a mental disorder or general medical condition. V62.89 Religious or spiritual problem, 299.80 Rett's disorder, 307.53 Rumination disorder, top. S. 295.70 Schizoaffective disorder, 301.20 Schizoid personality disorder, schizophrenia, 295.20 Catatonic type, 295.10 Disorganized type, 295.30 Paranoid type, 295.60 residual type, 295.90 undifferentiated type, 295.40 schizophreniform disorder, 301.22 schizotypal personality disorder, sedative, hypnotic, or anxiolytic, 305.40 abuse, 304.10 dependence, 292.89 induced anxiety disorder, 292.84 induced mood disorder, 292.83 induced persisting amnestic disorder, 292.82 induced persisting dementia, 292.11 induced psychotic disorder, with delusions, 292.12 induced psychotic disorder, with hallucinations, 292.89 induced sexual dysfunction, 292.89 induced sleep disorder, 292.89 intoxication, 292.81 intoxication delirium, 292.9 related disorder NOS, 292.0 withdrawal, 292.81 withdrawal delirium, 313.23 selective mutism, 309.21 separation anxiety disorder, 318.1 severe mental retardation, sexual abuse, v61.12 sexual abuse of adult, v62.83 sexual abuse of adult, 995.83 sexual abuse of adult, v61.21 sexual abuse of child, 995.53 sexual abuse of child, 302.79 sexual aversion disorder, 302.9 sexual disorder NOS, 302.70 sexual dysfunction NOS, 302.83 sexual masochism, 302.84 sexual sadism, 297.3 shared psychotic disorder, v61.8 sibling relational problem, sleep disorder due to indicate the general medical condition, 780.54 hypersomnia type, 780.52 insomnia type, 780.59 mixed type, 780.59 parasomnia type, 307.46 sleep terror disorder, 307.46 sleepwalking disorder, 300.23 social phobia, 300.81 somatization disorder, 300.82 somatoform disorder NOS, 300.29 specific phobia, 307.3 stereotypic movement disorder, 307.0 stuttering, top T, 307.20 tic disorder NOS, 307.23 Tourette's disorder, 307.21 transient tic disorder, 302.3 transvestic fetishism, 312.39 trichotillomania, top U, 300.82 undifferentiated somatoform disorder, 300.9 unspecified mental disorder, top B, 306.51 vaginismus, vascular dementia, 290.40 uncomplicated, 290.41 with delirium, 290.42 with delusions, 290.43 with depressed mood, 302.82 voyeurism, top